Do you feel your legs getting weaker as you get older? In today's video, we'll reveal the only two plants that really combat leg weakness in old age. They're natural, affordable, and can make all the difference in your quality of life. Stay tuned until the end and find out how to use them correctly. As we age, it is common to notice a gradual loss of strength in our legs. Simple everyday activities such as climbing stairs, walking long distances, or even getting up from a chair begin to require more effort than before. This change does not happen overnight. It is the result of a slow, silent process that is often ignored until it becomes limiting. But why do our legs weaken with age? The answer lies in a combination of physiological, metabolic, and behavioral factors that occur in the human body as we age. The first and most important factor is sarcopenia, which is the natural loss of muscle mass related to age. Starting at age 30, we begin to lose about 3% to 8% of our muscle mass per decade, and this rate can accelerate significantly after age 60. This muscle loss is not limited to aesthetics or brute strength. It directly affects the body's mobility, balance, and functional capacity. Since the legs carry the body's weight and are involved in virtually all movements, from walking to getting out of bed, they are particularly impacted by this muscle loss. Sarcopenia is driven by hormonal changes such as decreased testosterone and growth hormone and the body's reduced ability to synthesize muscle protein. Another relevant factor is reduced bone density, a common problem among older adults, especially women after menopause. This condition, called osteopenia or osteoporosis in more severe cases, does not directly affect the muscles, but it compromises the structural support of the legs. More fragile bones make a person more vulnerable to falls and fractures, which in turn leads to immobility and muscle disuse, further intensifying leg weakness. This bone fragility is aggravated by a lack of calcium, vitamin D, and sun exposure, as well as genetic factors. In addition, aging affects the circulatory system, especially in people who are sedentary or have a history of diseases such as hypertension, diabetes, and high cholesterol. The arteries and veins in the legs can become less efficient at pumping blood back to the heart, leading to a feeling of heaviness, tingling, or even pain when walking, typical symptoms of poor circulation. With less oxygen and nutrients reaching the muscles, leg performance decreases significantly. Poor circulation can also result in varicose veins, frequent cramps, and early fatigue, contributing to a feeling of constant weakness. We cannot ignore the impact of lack of regular physical activity throughout life. The human body was made to move, and a sedentary lifestyle is one of the biggest enemies of muscle health. When we stop using a muscle group frequently, the body understands that there is no longer a need to maintain that muscle at full capacity and begins to reabsorb part of its mass. This process of disuse occurs very often in the legs of older adults who spend most of their time sitting or lying down. Over time, lack of exercise reduces motor coordination, flexibility, and strength, making basic movements more difficult and painful. Another factor that aggravates leg weakness is the accumulation of silent inflammation in the body, often the result of a diet low in nutrients and high in processed foods, sugars, and bad fats. This type of diet contributes to an increase in free radicals, which damage muscle cells and hinder their recovery. Low-grade chronic inflammation is also associated with insulin resistance, which negatively affects muscle energy metabolism, leading to fatigue and progressive weakness. Mental health also plays an important role in this process. With advancing age, many people experience depression, anxiety, or loneliness, which drastically reduce their motivation to exercise. Apathy and social isolation lead to inactivity, which fuels a negative cycle. The less you move, the weaker your body becomes, and the weaker you are, the less motivation you have to move. In addition, neurodegenerative diseases such as Parkinson's and Alzheimer's interfere with the connection between the brain and muscles, reducing motor control and leg stability. Finally, it is worth remembering that many older adults live with chronic diseases and take medication on a regular basis, which can also interfere with muscle strength. Medications such as corticosteroids, sedatives, and even some types of high blood pressure or cholesterol medications can have side effects such as fatigue, muscle weakness, or loss of coordination. These effects, added to those already mentioned, create an environment conducive to loss of leg function, making them more fragile, less resistant, and more susceptible to injury. In summary, leg weakness during old age is the result of a set of natural changes and lifestyle habits accumulated over time. It should not be seen as something normal or inevitable, but rather as a warning sign that the body needs attention, care, and stimulation to remain active and functional. With simple changes in diet, lifestyle, and the use of natural therapies and medicinal plants, such as those presented throughout this video, it is possible to prevent, reduce, or even reverse this condition, promoting greater autonomy, vitality, and quality of life in old age. Weakness in the legs is one of the first signs that the body is losing some of its functional capacity over time. Although many people only start to pay attention when the weakness is already at an advanced stage, the symptoms appear subtly and progressively. Identifying these signs as early as possible is essential to prevent serious complications, such as falls, immobility, and loss of independence. The symptoms of leg weakness in older adults are not limited to difficulty walking. They manifest in different physical, sensory, and even emotional ways, profoundly impacting quality of life. The most obvious symptom, and perhaps the most common, is a constant feeling of tiredness or heaviness in the legs, even after minimal exertion. Older adults often report that walking for a few minutes is enough to cause fatigue, or that they need to sit down frequently to rest their legs. This feeling is not necessarily linked to conventional physical tiredness, but to a real loss of muscle strength, which prevents the muscles from supporting the body for longer periods. Along with this comes the perception that the legs are wobbly or unsteady, as if they are no longer under the same control. Another very common symptom is instability when walking, technically known as unsteady gait. Older adults may begin to take short, shuffling, or hesitant steps. It may take longer to start moving, as if the brain and body are not perfectly synchronized. This is because muscle weakness compromises balance and motor coordination, two essential elements for safe walking. Gait becomes slower and less fluid, and the risk of tripping, falling, and having accidents at home increases considerably. In many cases, older adults begin to avoid walking on uneven ground, climbing stairs, or leaving the house alone for fear of falling. Frequent falls are undoubtedly one of the most alarming and dangerous signs of weakness in the legs. They should not be seen as a normal part of aging, but rather as a clear symptom that something is wrong with the muscles or body stability. A fall can cause fractures, head trauma, and even permanent sequelae, in addition to the psychological trauma it causes. After a fall, it is common for older adults to develop a fear of moving, which further aggravates weakness due to muscle disuse. Thus, a vicious cycle sets in where the fear of falling leads to inactivity, which in turn leads to loss of strength, further increasing the risk of falling. In addition, it is common for older adults with leg weakness to experience persistent muscle pain, often associated with local inflammation, tension, or even cramps. These pains can arise both during movement and at rest, and are usually linked to the overload that weaker muscles suffer in an attempt to compensate for the loss of strength. When the muscles can no longer support the body's weight properly, other structures such as joints and tendons end up taking over this role, leading to pain in the hips, knees, and ankles. This condition is aggravated by poor posture and altered gait, which increase joint wear and contribute to the development of diseases such as osteoarthritis. A less talked about but extremely important symptom is loss of sensation or tingling in the legs. This symptom may be related to poor circulation or peripheral neurological problems such as diabetic neuropathy, which is common in older adults with diabetes. Loss of sensation further impairs balance and spatial awareness, making simple tasks such as walking or getting up from a chair much more challenging. In some cases, older adults may not notice minor injuries, blisters, or inflammation in their legs and feet, which increases the risk of infection and complications. Another sign that deserves attention is difficulty getting up from a sitting or squatting position, such as getting out of bed, getting up from the toilet, or getting up from a chair. This is because these movements require intense work by the thigh, gluteal, and calf muscles. When these muscles are weakened, the body needs extra effort to perform basic tasks. Many older adults begin to lean on furniture, walls, or other people to get up, which may seem harmless, but is a clear sign of functional loss. Reduced independence in daily tasks is an indirect but extremely relevant symptom. When the legs lose strength, older adults begin to depend on others for activities they once did on their own: bathing, going to the bathroom, cooking, or even walking to the front door. This loss of independence profoundly affects self-esteem and can lead to feelings of uselessness, sadness, or even depression. In many cases, older adults hide their difficulties for fear of being considered a burden, which delays diagnosis and intervention. Finally, it is important to note that the symptoms of leg weakness can vary in intensity from person to person, but they all indicate that something needs to be done. The good news is that muscle weakness, even when already established, can be reversed or controlled with the right combination of care, regular exercise, proper nutrition, supplementation, and, as we will see later in this video, the use of medicinal plants with strengthening and anti-inflammatory properties. The first step is always to recognize the symptoms. The earlier they are identified, the greater the chances of preserving mobility, autonomy, and quality of life in the elderly. When we talk about strengthening the body naturally, especially in later stages of life, it is essential to know the plants that offer nutrients and bioactive compounds capable of regenerating and protecting the muscular system. Among the most powerful medicinal plants in this regard is Moringa oleifera, often called the tree of life or miracle of nature. Native to India but now cultivated in many parts of the world, moringa has been widely studied for its extraordinarily rich composition of proteins, essential amino acids, vitamins, minerals, and antioxidants, all elements that are essential for keeping muscles active, strong, and resistant to aging. The main reason moringa has become a powerful ally against muscle weakness is its concentration of high-quality plant proteins, something relatively rare among plants. Its leaves contain a remarkable combination of essential amino acids, which are those that the human body cannot produce on its own and must be obtained through food. These amino acids are essential for protein synthesis, the process by which the body rebuilds muscle fibers that have been damaged or degraded over time. As we age, the body's ability to produce muscle proteins naturally declines, and the supply of amino acids becomes even more crucial. Moringa helps to fill this gap by providing the body with the building blocks it needs to maintain muscle mass and strength. In addition to its direct action on the muscles, moringa is rich in vitamins and minerals that participate in neuromuscular and metabolic functions essential for mobility. Among the nutrients present in the plant's leaves, vitamins A, C, E, and B complex stand out, especially B12 and B6, which aid in proper nerve function and communication between the brain and muscle. Vitamin C, in turn, is a powerful antioxidant that fights free radicals, preventing premature cellular aging of muscle tissue. Vitamin E protects muscle cells against oxidative stress, a key factor in sarcopenia and muscle degeneration. Another important point is the presence of minerals such as calcium, magnesium, potassium, and iron, all of which are essential for the functioning of the musculoskeletal system. Calcium, for example, is not only involved in bone health but also in the muscle contraction process. Without enough calcium, muscles cannot contract efficiently, which leads to fatigue and weakness. Magnesium is involved in more than 300 biochemical reactions in the body and is an important cofactor in muscle energy production. Iron, in turn, participates in the formation of hemoglobin, which transports oxygen in the blood. When muscles receive more oxygen, they have more energy to function, recover faster, and resist fatigue better. Moringa offers all these minerals in good amounts, making it a highly effective natural supplement for those seeking strength and vitality. But the benefits of moringa go beyond nutrition. This plant also has anti-inflammatory and analgesic properties, which are extremely important in the context of muscle weakness. Aging is often associated with chronic low-grade inflammatory processes that weaken muscles and cause joint pain. The bioactive compounds in moringa, such as flavonoids, polyphenols, and isothiocyanates, work to combat these inflammations, reducing muscle pain, stiffness, and even the effects of diseases such as arthritis or fibromyalgia. By reducing inflammation, the plant contributes to an internal environment more conducive to muscle regeneration and strength recovery. Another notable benefit of moringa is its effect on energy metabolism, which is essential for leg vitality and overall mobility. Its leaves contain substances that help balance blood sugar levels, which is crucial for people with type 2 diabetes or insulin resistance, two conditions that seriously compromise leg muscles. By preventing glucose spikes and improving insulin sensitivity, moringa helps muscles absorb nutrients better and produce more energy for everyday movements. For older adults, one of the biggest challenges in supplementation is finding foods that are easy to consume, well tolerated by the body, and offer multiple benefits at the same time. In this sense, moringa stands out. Its leaves can be consumed in various ways, in capsules, powder, teas, or added to soups, juices, and smoothies. It is an extremely versatile plant, and even in small daily amounts, it is capable of providing significant nutritional support. The powder from the dried leaves, for example, can be mixed with food without significantly altering the taste, which facilitates its inclusion in the routine of elderly people with more sensitive palates. It is worth emphasizing that moringa is not a miracle plant, but rather a powerful tool within a healthy lifestyle that includes a balanced diet, exercise, and regular medical care. It should be seen as a natural, safe, and highly nutritious support for those seeking to maintain leg strength, regain vigor, and preserve autonomy for longer. And the most interesting thing is that, because it is an accessible plant, it can even be grown at home in backyards or pots, making it a sustainable and economical ally for health in old age. When it comes to combating weakness in the legs, especially in old age, it is impossible to ignore the crucial role of healthy blood circulation. The legs are the furthest parts of the body from the heart, and therefore depend on an efficient circulatory system to receive oxygen and nutrients and eliminate toxins. Poor circulation can cause a feeling of heaviness, constant tiredness, swelling, numbness, cramps, and even incapacitating pain. Therefore, it is not enough to simply strengthen the muscles. It is equally essential to activate and improve blood flow. And that is precisely where the second plant in our video comes in, ginger, an ancient root with recognized medicinal uses, which acts as a true natural circulation stimulant and a powerful tonic for the cardiovascular system. Ginger, whose scientific name is Zingiber officinale, has been used for thousands of years in traditional medicines in Asia, Africa, and the Middle East, both as food and as medicine. Its therapeutic value is widely recognized by modern science, mainly thanks to its rich composition of bioactive compounds such as gingerol, shogaol, and zingerone, substances with strong anti-inflammatory, antioxidant, vasodilator, and analgesic properties. These compounds have the ability to act directly on the walls of blood vessels, promoting relaxation and dilation of the arteries, which facilitates blood flow to the leg muscles, improving their nutrition and oxygenation. As we age, blood has more difficulty circulating freely, especially in the extremities of the body. Poor circulation contributes not only to weakness, but also to a tingling sensation, swelling in the ankles, cold feet, and even numbness in the lower limbs. In addition, it is linked to diseases such as thrombosis, varicose veins, and intermittent claudication, a painful condition in which reduced blood flow causes leg cramps when walking. Ginger acts as a natural vasodilator, helping to reduce blood viscosity and prevent clot formation. This makes it especially useful for older adults who already show signs of impaired circulation or have a history of vascular problems. Another valuable aspect of ginger is its ability to reduce chronic inflammation, which is one of the main hidden causes of muscle weakness and joint stiffness. Chronic inflammation affects the capillaries and smaller vessels, impairing blood flow to muscle cells. The gingerols present in ginger inhibit inflammatory enzymes in the body, such as COX-2, reducing swelling and pain in the legs, as well as improving mobility. This anti-inflammatory action also makes it effective in relieving symptoms of arthritis, which is very common in older adults and one of the causes of limited movement and pain when walking. It is important to note that ginger also stimulates metabolism, which has a direct impact on physical disposition and muscle energy. It promotes increased thermogenesis, the process by which the body burns calories to produce heat, and this helps keep tissues active, including the leg muscles. With a faster metabolism, nutrients reach muscle cells more efficiently, promoting recovery and performance. This action is especially useful for older adults who suffer from constant leg fatigue, even with little effort, as ginger helps the body to better utilize available energy. From a cardiovascular standpoint, ginger helps control blood pressure and regulate cholesterol levels, two factors that, when uncontrolled, directly compromise circulation. High blood pressure hardens and narrows blood vessels, hindering flow to the extremities, while the accumulation of cholesterol in the arteries forms plaques that partially or totally block the passage of blood. Studies show that regular consumption of ginger can help reduce LDL, bad cholesterol levels, increase HDL, good cholesterol, and improve blood vessel elasticity, acting preventively against serious diseases such as stroke and heart attack, problems that are common among the elderly but often silent until they manifest acutely. The versatility of ginger is another factor that makes it easy to incorporate into your routine. It can be consumed fresh in teas, grated in salads, added to juices, smoothies, soups, or even as a powder in capsules. One of the most common uses is ginger tea with lemon, which not only warms the body and stimulates circulation, but also provides an extra dose of vitamin C, enhancing its antioxidant effect. For therapeutic purposes, daily and moderate use is recommended, with guidance from a healthcare professional, especially if the person is taking anticoagulants, as ginger can enhance their effects. In addition to oral consumption, ginger can also be used topically in the form of essential oils or compresses to activate local circulation in the legs. When applied directly to the skin, ginger oil causes a slight warming sensation, improving superficial blood flow and relieving muscle pain. This technique is widely used in herbal medicine and massage therapy for people with tired legs, varicose veins, or joint stiffness. External use can be combined with gentle massage, promoting venous return and a feeling of lightness in the legs. Knowing which plants help combat leg weakness is already a fundamental step. However, just as important as knowing their benefits is understanding how to use them correctly. The effectiveness of moringa and ginger is directly related to how they are prepared, how often they are consumed, and how they are combined with other healthy habits. Often, the mistake lies precisely in improper use, excessive consumption, preparation that reduces the active ingredients, or isolated use without an adequate dietary context. In this topic, we will explore in depth the best ways to include moringa and ginger in your daily routine, respecting their natural characteristics and enhancing their effects on muscle strength and circulatory health. Let's start with moringa, the plant considered a true natural pharmacy. Its leaves are the most nutrient-rich part and the most common form of consumption. One of the most traditional ways to use them is in tea made with the dried leaves. To do this, simply boil 250 ml of water, turn off the heat, and add a tablespoon of dried moringa leaves. Cover the infusion for 10 minutes, strain, and drink warm. This tea can be consumed once or twice a day, preferably in the morning and afternoon, never at night. As moringa can have a slight stimulating effect on some people, it is important not to boil the leaves together with the water, as this can degrade some of the heat-sensitive vitamins, such as vitamin C and some of the B-complex vitamins. Another very practical way to consume moringa, especially for those seeking muscle strengthening, is to use dried leaf powder. It can be found in health food stores and is extremely versatile. It can be mixed into juices, smoothies, yogurt, yogurt, soups, broths, or even sprinkled on fruit or cereal. The safe and effective dose is usually around 1 to 2 teaspoons per day, always following the manufacturer's instructions or the advice of a healthcare professional. Moringa has a slightly bitter taste, but when combined with sweeter foods, such as banana or papaya, it tends to mask the taste well. It is an excellent alternative for older adults who have difficulty chewing or swallowing capsules, as the powder is light, easy to digest, and easily absorbed by the body. For those who prefer a more concentrated and practical solution, there are moringa capsules, which guarantee the exact dosage of the active compounds. This form is ideal for those who lead a busy life or do not like the taste of the plant. Normally, 500 milliounce to 1000 milliounce capsule is taken per day with meals. However, even though it is natural, moringa should not be consumed in excess. The excessive use can cause side effects such as nausea, sleep disturbances, or gastric irritation in more sensitive people. Therefore, it is essential to respect the recommended amounts and remember that more is not always better. Now, moving on to ginger, we have an equally powerful root, but with different characteristics. Ginger can be consumed fresh, dried, powdered, in capsules, or as an essential oil, depending on the therapeutic purpose. The most popular form of consumption is ginger tea, widely used to activate circulation, reduce muscle pain, and warm the body. To prepare it correctly, cut about 3 to 4 thin slices of fresh ginger and add them to 300 milliliters of water. Boil for 10 minutes, turn off the heat and let it steep for another 5 minutes before drinking. This tea can be taken up to twice a day, especially on cold days or after physical activity when the body needs circulatory stimulation. For those who want a stronger effect or have very poor circulation, the tea can be intensified with lemon and a pinch of turmeric, creating an even more powerful anti-inflammatory and antioxidant drink. For direct consumption, fresh ginger can be grated and added to green juices, broths, teas, or even salads. The general recommendation is up to 5 grams per day of fresh ginger, the equivalent of a level teaspoon of grated ginger, as too much can cause heartburn or irritation of the gastric mucosa, especially in people with a history of gastritis. Another practical and effective alternative is ginger powder, widely used in cooking and also in capsules. It concentrates the active ingredients, which requires moderation. A small amount, about half a teaspoon per day, is enough to obtain its effects. For those who do not like the spicy taste of fresh ginger, capsules are an excellent alternative. The recommended therapeutic dose is usually 500 milligrams to 1000 milligrams per day, always under professional supervision, especially if the person is taking anticoagulants or antiplatelet medications. In addition to oral consumption, it is worth remembering that topical use of ginger is also highly effective for stimulating circulation in the legs. Ginger essential oils diluted in vegetable oil, such as coconut or almond oil, can be used to gently massage the lower limbs. These massages not only activate local circulation, but also relax the muscles, reduce pain, and aid venous return. For an even more complete effect, warm ginger tea compresses can be applied to the legs for 15 to 20 minutes, especially at the end of the day. It is important to remember that both moringa and ginger are natural supplements and are not substitutes for a balanced diet, exercise, or medical treatment. Their use should be integrated into an active lifestyle with good hydration, adequate protein consumption, and if possible, regular physical therapy sessions or walks. The best results come when these plants are used continuously, disciplined, and guided, respecting the rhythm of each organism.